But the Journal's reporting shows Facebook takes that to a new level. Joining us, Wendy Dickinson, licensed psychologist, founder of Grow Restored, a counseling and leadership development organization, along with Dr. Kathryn Kuhlman, clinical psychologist who treats patients suffering from PTSD, depression, and other issues. Ladies, thank you for being with us. Dr. Dickinson, I guess it shouldn't surprise us that this is happening, but is there a way to protect ourselves other than just deleting a Facebook account?
Well, I think we have to be educated and we have to be wise about what's going on. And we, more than anything else, have to help educate our teens about the way these platforms are designed. They're designed to be addictive. Every time something refreshes or you get another like, you get a hit of dopamine, which causes you to come back. It's the feel-good chemical. And it's really important that we educate, especially our teens, but also ourselves on what's going on here. And the fact that you have to be careful about the amount of social media that you're consuming.
So, Dr. Kuhlman, when you hear a hit of dopamine, is that the same thing that happens if you take an illegal drug of some type, or what does it compare to for the rest of us?
So dopamine, it's what makes you feel good. And so that's really what keeps addictions going. So yes, it could be a drug, but dopamine also gets released when you pet your dog and you see your dog when you walk in the house at the first time. And so it's these feelings of elation and joy and love that start to be released whenever you're doing something that you enjoy. And so as Dr. Dickinson had mentioned, when you refresh that screen, whenever you get a like, whenever you get a new comment, that releases dopamine, and that feeling gets reinforced over time.
Yeah, and clearly they know that that's happening, and they've designed the algorithm that way. This Wall Street Journal op-ed caught our eye. It's from a philosophy professor, so somewhat in the same realm. What have I done to deserve this? America's obsession with indiscriminate affection and affirmation has me wondering whether I've really earned it. Apparently, I deserve affordable health care, high-speed internet access, deserve to retire with dignity, and he goes on and on. Is social media, Dr. Dickinson, any part of this, that this all becomes about me and me and me as I look through Instagram?
Yeah, I think we have to keep in mind that it's a bit of a warped reality, right? It's not the same thing as having relationships with people face to face. There's a self-focus that can happen that leads you down all kinds of different paths, thinking that things are all about you, having an imposter syndrome. We know that it leads to higher levels of anxiety, depression, isolation, loneliness. So there's a lot of ways that it changes your perception about what's real and really causes us to start to question what's going on.
We had a privacy expert on earlier in the week to talk specifically about the Instagram issues as it relates to teenagers and how they sort of really prey upon teenagers. Take a listen.
Their whole goal is to keep you addicted. And when you constantly get people to react and respond to every waking thought and image that their friends have, you're going to breed insanity. And that's part of what they've done here.
Dr. Kuhlman, it's a little bit different when you prey on adults than when you prey on kids. Specifically as it relates to teenagers, is there a difference here between how teenage boys and teenage girls deal with this?
Absolutely. And it really comes down to the way that the brain has not developed yet into adulthood. Adolescent and child brains they have a lot of elasticity, which is great for learning. It means that they're kind of like a sponge and they can soak things up. But what that also means is that they are far more susceptible and vulnerable to this kind of manipulation.
All right. Ladies, appreciate it. Great conversation here. And unfortunately, we don't have enough time to get to some of the more pressing issues about really how do we protect kids from this. Perhaps some of the responsibility lies with Facebook. Dr. Dickinson, Dr. Kuhlman, great conversation. We'll have you both back. Thank you. Good to see you. Their love is unwavering, and it is